Hey, we're live. Hello, everyone, and welcome out there in the NOCD world. Once again, we are here with your Wednesday night webinar through NOCD. This being the third Wednesday of the month, that means it's our Diversity Matters series that we will be doing. And tonight, we are joined by Dr. Jamie Feusner and Dr. Elise Curry. Hello. Hello, everybody. So,
Hi.
I'm going to let you guys introduce yourself. Elise, do you want to go first and tell everybody about who you are and why we're here and all those things? That'd be great.
I'm Dr. Elise Curry. I've been working with NOCD for 4 months now, I think. And I've worked a lot with gay, lesbian, bisexual clients, coming out issues. And now I have OCD to add to that. And so I work a lot with people who are worried they might be gay, or worried they might be straight, or worried they might not be transgender, or whatever it is they're identified with. They're worried that maybe they're a fake and a liar and that everyone's going to find out. So that's a pretty powerful OCD to work with, but we can definitely get good results with it.
All right.
So I'm happy to be here tonight.
Great. And Jamie?
Yes, I'm Dr. Jamie Feusner, and I am the Chief Medical Officer at NOCD, and I've been with NOCD for about 2 years now. I'm also a Professor of Psychiatry at UCLA, and I'm the Director of our OCD Intensive Treatment Program at UCLA. So I've been treating OCD for many, many years and running the program there. And so I've had many patients that had OCD concerns about sexual orientation and about transgender as well. I've also treated people who are transgender in terms of helping them with their transitions and other related issues. And I do research in transgender, do research in OCD as well. A bit more recently, I've been doing research in transgender individuals. So mostly brain imaging research that I've been doing. And I'm glad to be here, and hopefully I can contribute something.
Well, we hope so too. You got to earn your keep here, Jamie. So just throw something out of these. All right. As we typically do our Wednesday night webinars, and especially with our diversity, I kind of play moderator. I'll watch the chats and throw some questions at you guys, but there's a couple of things first, I think, that maybe we just want to start off with. And so let me throw out, we have GLBTQ. What are all the letters? What does each of them mean? Just so that we can all kind of approach tonight from the exact same kind of orientation, shall we say, of how we're looking at things.
So I don't know. I can start. I can jump in. Yeah. The topic today with the Diversity Matters is we're talking about gender diversity, sexual orientation diversity, and so lesbian, gay, bisexual, trans, queer. So those are LGBTQ.
Just for queer, can we get maybe a definition around queer for people to understand?
Yeah, I think of those queer people, not everybody may be familiar with the term queer, and also the term queer has kind of been used differently, I think, over the years. So in general, queer, that term has a kind of a general meaning of really kind of not following conventional gender distinctions. And more recently, you might hear the term genderqueer to make it a little bit more specific, because queer itself could, in the past, could involve more sexual orientation, and now the term genderqueer could be more specific to gender distinctions. And that's something, of course, it may seem kind of basic, but it's a very important point, is that sexual orientation is different than one's gender identity. They're totally different concepts. And so somebody who's genderqueer could be of neither genders, not a male gender, not a female gender, or they could experience themselves as being of both genders, or some kind of combination of a male or female gender in some way. So it's kind of a general term. And then there's another term just to bring up that you may hear about a lot called non-binary. And so binary referring to binary male or female. And so somebody could be cisgender, which means that their gender identity aligns with the sex assigned at birth for them. And somebody could be transgender, where their identity aligns with the sex opposite to that assigned at birth to them. And then non-binary is not either one of those binaries. So in other words, binary could refer to somebody who's cisgender or transgender, but non-binary means the person doesn't identify with male or female. And so they might identify with some combination of them or somewhere in between, or they may describe themselves as gender fluid. You hear that sometimes, and gender fluid means that their gender identity might be different at different times.
Yeah,
Elise, please.
Yeah, queer has been used against us as a mean term. You might have been called queer as a kid. It's a bad thing. So it's a way to reclaim the word and say, I'm queer and I'm proud. And, you know, we've done that with a lot of things, like dyke used to be a really bad word. And now we have dykes on bikes who start the gay parade and their motorcycles. So it's like, it's reclaiming a word and saying, you're not going to use that against me. I'm going to use it in a positive way. So you'll see a lot of that kind of thing going on as well.
Yeah, and Elise, you're referring to queer in the sense of sexual orientation. Yeah, so so that's queer, then gender queer. So they're kind of different, referring to different things.
Yeah, and then there's aromantic and asexual, and a lot of A things as well, which means you're not one of those things.
Agender too. I forgot to mention agender. Yeah.
So there's a lot of terminology that's just come out, maybe in the last 10 years, that it's really hard to keep up with, even for us. So if you're confused, you know, there's a reason for that.
Okay, so just to be clear to everybody out there, then I might have Jamie, as you said, a gender assigned at birth, but now feel that I'm no gender whatsoever. I'm kind of nothing.
Yeah, so actually, we'll refer to the term sex assigned at birth. So, so like when
there we go.
Yeah,
there we go. Oh, thank you.
Thank you. Yeah, so sex and gender is different. So sex refers to your really like your chromosomes, and you know, so at birth the doctor usually assigns a sex to you, and that goes on your birth certificate, and that, you know, that's based on blood tests with your chromosomes, and it's based on your genitalia and things like that. So that's but somebody's gender is what they identify with is their self-identity.
That's a psychological term.
Thank you.
Yeah.
Thank you.
And then you could have ambiguous genitalia, just to throw that out. And so the doctor might have picked one and it doesn't fit you. So there's that as well.
Yep. Like hermaphroditism, for example. There's kind of in between male and female.
Okay. That's a lot of stuff. So thank you.
A lot of info.
Yeah, no, it is. And you know, again, I love to ask these questions because I think sometimes people are afraid to ask these questions. So in the true exposure and response prevention world, I'm going to be the person to ask some of these questions. And even if they might be awkward or uncomfortable, that it's good to get it out there and just so that everybody kind of knows what we're talking about and is kind of in agreement on this.
I was gonna say, I have like a kind of a graphic that might be nice.
Oh, okay.
To see if you guys see if I can share my screen here.
I think there's a screen button up on the top there.
There it is. Okay. Alrighty. Okay. You guys see that?
Yeah.
This is a slide. I'm borrowing this from a presentation and a training actually that I did at UCLA that was given by the LGBTQ Campus Resource Center. So I'm borrowing their slides. And so that's why you see Jay Bruin as the UCLA mascot. So here's an idea. So sex assigned at birth, that we were just talking about this, male, female, intersex. And then a gender identity is a person's concept of their own gender. So it could be agender on one end, or it could be man, woman, or it could be gender queer, non-binary. And gender expression, so this is identity, this is like internal identity. Their expression, which is what they may express outwardly, could be masculine or feminine. Is anywhere on this continuum. In the middle, we would call it androgynous.
Okay.
And then as a separate concept, you have sexual and romantic attraction. Or sexual orientation. So somebody could be asexual or aromantic, or they could be sexual and romantic, and that could be attracted to a different gender than self, or same gender, or multiple genders.
Okay.
So hopefully that's helpful.
Yeah. That's great. I think that obviously people so often, and probably what we see a lot in the OCD world too, is that the idea, I'm going to bring in the idea of attraction here, that if in orientation OCD, if I find myself attracted to someone that isn't in the area that I identify with, it means suddenly that I must be that thing, right?
Mm-hmm.
And that I can just switch like that and become something that I don't identify as.
Yeah.
Would you say that's about right?
Mm-hmm.
And the other thing that can happen is let's say that they identify as heterosexual and all their experiences have been heterosexual and they've been positive. So there's like no reason to think they might be gay or bisexual at all. But then they start getting this thought in their head one day, maybe I'm gay, maybe I'm really gay. And this is completely a farce. And the thought won't go away. And it starts to really bother them over and over and over. And that's when the OCD is kicking in.
Yeah, another thing I think that happens with people with OCD, not just for this type of OCD, but many types of OCD, is sometimes thinking in a very black and white way, right? Like, I have one thought or one experience, about someone that I see or I feel attracted. Maybe it's just happening. It's happened like a couple times, or it happens once. And therefore, it must mean this, like that one instance means this, and a hard time understanding the kind of more shades of gray. Like, well, people that are heterosexual, it doesn't mean that they have no kind of feelings towards somebody of the same sex ever, But people with OCD, often it's very kind of black and white.
Yes, and actually, Kinsey had a scale a long, long time ago. He was ahead of his time.
Mm-hmm.
Sexuality was on a continuum, like a 1 to 10 scale.
Mm-hmm.
So if you're a 1, you're like totally gay or lesbian, and there's nothing in your mind about anything else. And if you're a 10, you're totally straight. And then there's everything in between. And most people are not on either end. People are gradations.
Yep.
But with
but with
OCD, they think that they'd have to be something either black or white. It's really binary.
And it's also something that is, so I've seen a lot of patients with this type of OCD who are, young adults or adolescents. And so I think that age is also an age where that people are kind of part of normative development is trying to figure out your sexual identity, your gender identity sometimes as well, and your sexual orientation kind of identity. And so that can be a really confusing time, right? Because it may not have kind of solidified, if it's going to solidify during that time either. And then that uncertainty is really difficult for people to tolerate, is like, I don't know. And, as a clinician, that's not something that I can tell you either, because I don't know what's going to happen with you. And because I treat OCD, that's really not the thing that I'm going to help you with figuring that out. I'm going to help you with your obsessions about it.
Mm-hmm.
And your compulsive behaviors regarding it.
Okay. So there's, of course, what was called HOCD, but really is better identified as probably orientation-based OCD. Maybe that would be a far better term, it sounds like, along the idea of then, because that one to me, and correct me if I'm wrong, because maybe now there's the addition with transgender and things too, but at least how we've kind of typically identified what was HOD OCD, now probably more orientation-based OCD, is the idea of, the stereotypical, I'm a married male, and one day I saw somebody and a thought popped in my head that they had nice eyes. And now suddenly, what if I leave my wife and my children and I become gay and I've lived a lie and everybody hates me and I'm going to be with a man, but I have no desire to, but now maybe I will be, or something like that. I mean, that's like your stereotypical kind of patient with that we see. But it really is everything, right? I mean, it could be, if I'm gay, what if I suddenly fear that I'll be straight and I see somebody of the opposite gender of mine and think, wow, they're really attractive. Oh my God, how does, mind blowing kind of thing. So and I know that especially on the app and in the NOCD community recently, there's been a lot of discussion around this. So I'm so excited that we're doing this tonight specifically. But I'm wondering if we could spend some time talking specifically about orientation-based OCD and the way that it manifests, the fears that it causes, and really the goals that we have for treatment of helping people who have this. So,
yeah.
Elise?
Yeah, I think it's important to mention that it was HOCD for a reason, because back in the day, you could be killed for being gay, you could be locked up, you could be electrocuted so they could try to make you straight. I mean, it's a terrible thing. In that time period, it was a really hard thing to be gay to start with. So if you feared it, you had all these awful consequences. And now, as our culture moves, it's not something that's so scary to be anymore. It's much more accepted. So as the culture changes, OCD changes as well. And that's why we're getting people who are worried they're straight because they have all these lesbian friends that love them. And what if they came out to them and I have a guy back there that I'm going to be dating soon. Sometimes their friends will just drop them. I've seen it happen. It's like, bye-bye, you're not one of us anymore. You're straight now. Goodbye. So that can be terrible and scary.
Yeah.
So it's interesting how the culture changes, and then we watch psychiatric diagnoses change as well as we go along. Mm-hmm. Like back in the day, people had a lot of religious rituals, and, there's a lot more stuff around religion. And so we saw a lot more of that, people being afraid of the devil. And now we don't see that as much.
Right.
So it just depends.
Yeah. And I think a common theme that underlies it, what used to be called HOCD, but I think it's good for us to get away from that term, is kind of an idea that I thought that I was something, but maybe I'm not.
Right.
Yeah.
The doubts, it's really the doubt, and when it comes to something like that, it can be really, really, really distressing for somebody, because their sense of who they are, what their life is going to be like, who they're going to get attracted to, who they're going to be in a relationship with, who they're going to associate with, all of that. It's very disconcerting to think that I thought it was one thing, and maybe it's not. Maybe it's completely different. Like I've been living a lie.
Yes.
And it's a really disconcerting feeling. Man, my patients suffer a lot about this. It's not, even though I think it's so hard for a lot of people to understand, like how difficult it is for people with OCD, and for somebody who doesn't have OCD, especially if they're talking to, say, a young person, an adolescent, or somebody in college who's going through this, they might think, well, whatever, like people are always trying to figure out their sexual orientation in college. But it's not just that. It's really, really disturbing. That's why it's OCD, because the emotions associated with it are so intense.
Yeah, it's terrifying for them.
Yeah.
Yeah.
Well, and I'm sure that for many people, it's already difficult enough if you, going on kind of our traditional aspect of looking things, are going to just discover that, I think I am gay, that coming out experience is probably already difficult enough for people. And then if OCD gets involved in it, and in the same kind of way, if you have lived in this more traditional kind of format and you're married and you have kids, and then this thought comes in your head and it just is like a train taken over and coming down the line at you, how terrifying all of this is. So you can see where there can be so much absolute fear that's going on for people when they're experiencing these types of things.
Yeah.
Yeah. And the other thing that can happen, people who don't have OCD could be married and have kids, and they've been pushing down their gay identity for so long, and it does pop up and they do change their life. So this actually happens.
Mm-hmm.
And that's more to OCD.
Yeah.
Because it's not something just in your head. This happens.
Yeah, right.
The guy down the street left his wife for Mr. Jim the mailman. And what if I do that now? And what if that were?
Yeah. And even though, like Elise was saying, even though things have improved, overall in terms of generally, I think people's acceptance of homosexuality, for example, or different sexual orientations, there's still stigma, and there's still parts of our society where this is not accepted.
Right.
And so it both Elise and I are in San Diego and Los Angeles, where it's, overall it's relatively accepted. But even here, there's still parts, there's definitely communities and families where that's not acceptable at all. And so it can be, a danger that something could happen in their family, as a family member or somebody in their neighborhood, school, so it's not just about their self-identity. It's also, I think, about the implications about how other people are going to treat them, and the fact that we still have the stigma in our society, and still have things like violence against people because of their sexual orientation or their gender identity,
or people getting fired from their job, or
discrimination. Yep.
A lot of layers of it. Yeah.
Right. I want to remind everyone, this is the NOCD webinar. We do these every Wednesday night. Every third Wednesday in the month is our Diversity Matters series. That's what we're doing tonight. And we're talking about orientation-based OCD and other issues with LGBTQA types of concerns that go along with OCD as well. And a reminder to all of you, if you're looking for teletherapy, NOCD is doing teletherapy in 25 states currently. And we have continuously gotten on more and more insurance panels all the time. If you're interested in reaching out to talking to one of our care team members to do a free 15-minute call to see if teletherapy with a NOCD therapist might be right for you, you can reach out to us at treatmyocd.com. Or if I just go through these two guys' heads right over there in the corner, you've got a yellow box up there with a blue hyperlink. You can click on that and get connected to the care team as well too. So that's what we have. Also, download the NOCD app. It's free. It's on iOS and Google Play. All right, thank you. Back here to everyone. So we've had some questions coming in. So I'll probably play like the Phil Donahue of the night and kind of go through and monitor. Some young people are going, who the hell's Phil Donahue? I don't even know who that is. But let's take a look and specifically see what we've got. So Tom asked, and I think we answered, but just to be clear, is cisgender what has typically or traditionally been described as a person's biological sex?
Not exactly, because again, gender refers to somebody's identity. Mm-hmm. So we usually refer to identity in relationship to like masculinity or femininity. So somebody who's cisgender, their gender identity is the same as their biological sex.
Okay.
Biological sex is also something we don't kind of use that term that very much. Sex assigned at birth is probably the better term. Yeah.
Mm-hmm. Is it possible that sexual orientation OCD / identity OCD is more prevalent today because society is more accepting of all the diverse orientations and identities? So OCD perhaps latches on to all of these possibilities.
Yes.
I think so too.
I've heard that before, that culture's changed and now we have more ways you can have OCD.
Mm-hmm.
Okay.
And by the way, I think, the different, all these different kind of expressions that we've been talking about today, I think probably this has always been the case, but people didn't have a way of understanding it, or either people didn't have a way of understanding, or they didn't have a way of expressing how they felt, or maybe very early on in their life, they felt like there was only a couple options for them, 2, maybe 3 options. But the reality is probably more, there's a continuum of options in the sense of the way that people can experience themselves and other people.
Tom says, what an exposure tonight for the HOCD viewers. Well, that's why we're here, Tom. Welcome. A lot of LGBT people are not okay with being called queer still. So there's just some discussions about, and as you said, Elise, it kind of depends on the community that you're in and everything too, right? So there we go. So let me ask this to you. Why does OCD feel so real, and why does it feel like it's not OCD at times?
Well, it's that happens with pretty much almost every type of OCD.
Every single time.
is that it doesn't always feel like OCD, and it's I've had some patients where where maybe almost all the time they understand, like, this is OCD, I know this is OCD, but yet, it's still very difficult to not do a compulsion. They have obsessions. But that's one of the insidious things about OCD, is that it often doesn't feel like this is, a product of my mind. It feels like this is kind of the reality of what's going on. And so other examples, outside of orientation OCD could be, even with, say, something like contamination fears, that, there are germs that live on door handles, so it's real, and maybe I should be doing something to avoid it.
Mm-hmm.
So part of the treatment involves recognizing OCD thoughts versus real reality-based thoughts. So trying to get your type of OCD, getting like, what color is it? What shape is it? When can I identify it? So it can't trick me.
Yeah, and I think from what I've seen therapeutically, of course, the hardest piece is the two words that are the bane of every therapist existence, and those are "what if," right? And how OCD will always have one more "what if" question than we have answer for. So therefore, the goal of treatment is not to convince somebody that something is real or not real. It's about getting somebody to be okay with the doubt and not knowing 100%. And that's the way almost everybody lives in the world, is never having 100% about anything. Even as we said earlier, like about maybe gender identification or orientations or those types of things as well too. So,
and also, oh, sorry, I was going to say, and uncertainty about what's going to happen in the future too.
Yeah. Can HOCD begin because someone specifically called you gay out loud multiple times, so it stuck to you? I think that it could cause the doubt, potentially, right? It could be the insidious kind of earworm thing that led you to wonder, did they see something about me that I don't know about myself, and do I need to investigate that to see if that might be true? Mm-hmm. That's a possibility, I suppose.
And then it depends if it becomes a sticky thought, because somebody who isn't worried about this might just think, oh, you're mistaken. And then they think about the hamburger they're going to eat later today. But if you have more OCD tendencies, you're going to grab onto that and try to like understand it and dig deep and look at it in a million ways, and it gets stuck.
Yeah, and we know that OCD is, roughly about 50% genetically determined on average, and about 50% environmentally determined. So environmental things include things that happen in your life, like teasing or being called names, or more traumatic things even than that happen. So that those types of experiences can be contributors, but in and of themselves, if you don't already have kind of the setup in your brain to develop OCD, it probably wouldn't be enough to cause it to happen, if that makes sense. So it's kind of a combination of the way your brain is wired and what happens to you kind of in your life.
Okay. Will I ever be fully cured of OCD, HOCD amongst the other forms that I deal with, or will I have to just learn how to manage it going forward in life? Well, I've never told anyone I would cure them in 20 years of treating OCD, and I don't think I've ever cured one person in treating them. So I'm either a massive failure as a therapist, or I've had a different goal, which is I'm going to teach you that you can learn to live with the thoughts that you have that pop into your head, or the images that you experience, or the urges that you have, which I want to get back to in a minute about HOCD for a moment. But that our goal is not to make them go away, because no one's figured that out yet. Our goal is to learn how to live with something and to become comfortable with being uncomfortable. You don't ever have to like it, but you have to just know that you can handle it. So.
Yeah, and when you get to that point, and you've had a lot of time to kind of practice that, the symptoms can get to a point where they're very minimal. So you're not really having to deal with them very often, and when they come up, they can be pretty mild, and you know exactly what to do to nip it in the bud so it doesn't blossom into something worse than that. So, but rarely, if ever, does it really kind of go away completely. It's a kind of a chronic condition, but certainly you can get to a point where it's so manageable that it's not interfering with your life.
Yep. Now, I want to go back to, because very often when we talk about OCD, we talk about OCD thoughts, but there's images and there's urges. So what if I experience an urge to be with somebody of a different gender or a same gender, depending on what my orientation is? Isn't that more real than a thought that I'm having an urge or an image pop into my head?
No, I think it's just a different form. I don't think it's more important or less important. OCD comes in lots of forms.
Yeah.
Okay. Well, how about this? I was thinking of that person, and I had a groinal experience. There was a little movement down there, or a bit of a tingle, and isn't that proof then that I must be attracted and want to have sex and with that person because of that experience?
No.
Yep.
Our bodies respond to many things. Sometimes we don't even understand it.
Okay. Yep. Our bodies are noisy. That's sometimes you'll hear that, is that things will happen and we have no explanation of why that happened. And things can happen and there is an explanation, but there's not necessarily like a lot of meaning behind it, even if it does. And also, just to, as a general thing, we're answering these questions, I think, because sometimes people have never kind of heard the answer to this, but it could be kind of a reassurance, so if you find yourself having to ask this question over and over again, then it's probably not good for you to hear it from us or somebody else over and over again, right? Because that's a reassurance.
These are one-time questions. Exactly.
Yeah, this is a one-time answer.
But it's always interesting that groinal response that is so often talked about, I'm using that as proof that something's real, and this is where very often I think in OCD we talk about thought action fusion, but I think we should also talk about feeling action, right? That having a feeling or a sensation is also just as bad in my head as actually doing something, right?
Yeah. And also keep in mind that the feeling, even though it feels like it's coming from there,
right?
You experience in your brain. You're actually experiencing your brain. Your brain is telling you that it's coming from there.
Yeah.
But maybe it's not coming from there.
Mm-hmm.
Maybe it's coming from something going on in your brain that's different.
Right.
Yeah, it's like if you watched a movie and you got some sexual feeling watching some actor or actress, does that mean you want to go date them, or that you love them, or that, does it mean all those things?
Well, maybe there is one really cute actress, but
for me,
but yeah, no,
you might have a fantasy about something. Like some people have rape fantasies, for instance. Do they really want to be raped? No, they do not. Maybe they want to be desired or dominated or something like that. But just because you have a fantasy doesn't mean you want to do it.
Right. So we can confidently say that OCD will take it to its worst extreme and make you believe that obviously, though, you do want to do it, because why else would you have had this thought or image or urge? The only rational, quote unquote, explanation must be you really want this, and this is who you really are.
And that's another common thing that is a thread that goes through a lot of different types of OCD, is adding extra meaning to something. So rather than just saying, oh, that's weird, I had that thought, or this is a passing thing, is to say, well, the fact that I thought that or felt that means something, and I need to figure out exactly what it means.
Mm-hmm.
Gotcha. Right. Has the incidence of HOCD increased in the last 20 years? Maybe talking about it, but I don't think the actual incidence has increased. But I think it's probably just more open to discuss, kind of like based on what you said, Elise, that it's more acceptable in the community, and bringing it up won't mean that you'll be hospitalized or sent to a get you straight camp or something like that, like that used to happen. Mm-hmm.
Yeah, there used to be a disorder in the DSM-3 too long ago.
The DSM is the Diagnostic and Statistical Manual for Psychiatric Disorders. So that's kind of a description of many different what are considered psychiatric disorders. And like Elise was saying, homosexuality used to be considered a psychiatric disorder. Now we understand it's not a psychiatric disorder. I mean, even then, I think many people understood it probably wasn't a psychiatric disorder. that it's just a difference in development that happens and different experiences. That's a variant, just a different variant of a human experience.
Rather than a pathology.
Exactly.
And the same thing with gender. Gender identity disorder used to be a thing.
Yeah.
And gender, then something is wrong with you.
And right now there's something in the DSM-5 that's called gender dysphoria. And gender dysphoria is really a description of dysphoria, just means bad feeling. The bad feelings that people have usually pre-treatment because their body doesn't match their sense of self in terms of gender identity. Probably in the near future, maybe the next version of it, that may be removed from the DSM. Most people in the field think it probably will be. Like homosexuality, that this is a variant of human experience. The dysphoria is really kind of just describing like a symptom that happens that is transient. If somebody gets treatment, it usually gets better.
Mm-hmm.
Right, because imagine being in the wrong body and you look in the mirror and that person isn't the one you feel like inside. I would be dysphoric.
Yeah.
That would be pretty awful.
Yeah, like a symptom or reaction, kind of a reaction.
Yeah. Mm-hmm. Can we talk about the correlation between ROCD and HOCD? So ROCD, or relationship OCD, and orientation-based OCD. I'll tell you, one of the ways I see it is that, am I supposed to be in this relationship? Maybe I'm not, because what if I'm actually attracted to somebody of the same sex that I am, and therefore I'm living a lie? So I've seen kind of the intersection of those two things happen like that. But how about for you guys?
Mm-hmm. Yeah, I've seen that.
So yes, absolutely, there can be a correlation going on there. Let's see if there's other ones around this topic. Oh, I'm wondering, Jamie, if you could tell us just a little bit from, maybe more as I search for some things, from the neurological kind of genetic aspect of this. I mean, there's obviously in the developmental phases, there's various influences of estrogen and progesterone and testosterone, and how it would be easy even in utero for people to be maybe less andronized, over andronized, or something like that. Like, I think of one of my cousins who is gay, and his mom, another cousin of mine, who said, yeah, I knew pretty much when he was like 3 that he was, it's just so, I mean, and maybe here's something too that I asked this question for this reason. There are some people who say, I've known my whole life I was gay, I've just identified that way. And there's other people who say, maybe kind of wondered, but it wasn't until later I came out. And then there's other people who maybe hid something just deep down for so very long. And then later on in life, we're finally hit with, oh my gosh, I actually am so unhappy this way, but I would be more happy that way. So I guess from the two of you, and maybe from life experiences of people that you've worked with or treated, what kind of happens maybe from birth on, and also what's that experience like for some people who just know versus some people who kind of have to develop into knowing and coming out and all of that? It's very awkwardly phrased, but hopefully you get what I'm saying. So.
Well, I could speak from my own experience. When I was about 16, I started identifying as bisexual. And so I had a football boyfriend, and then I had a best girlfriend. And I liked them both, right? Yeah. But then the phone would ring, and I would hope it was her.
Oh.
And I remember just the first awareness was, oh, that's interesting that you wish it was her. Most people would wish it was the football boyfriend. That was my first little tiny awareness. And then over time, I realized I was a lesbian and stopped seeing men. But it was a process. And because I had very liberal parents, when I told my mom about it, she said, okay, well, just see how you feel in the next few years. And, we'll talk about it again. Just exploring. So it wasn't like a bad thing. So I didn't have a bad coming out that way, which is very fortunate.
That's great.
I think it's also different for women and men too. Sometimes I hear from men that they just knew when they were 5.
Okay.
That. Women it seems like it takes us longer to figure that out.
Yeah,
okay.
It is. it is more common for homosexual men to have felt that way from really early on.
Yeah.
Whereas for women, some women feel that way from very early on, and some of them it kind of develops later. So there's a little bit different between men and women that way. But you know, even with men, there's some that where it wasn't something they were really clear about early on, and that may have been either because they may have felt oriented sexually towards the opposite sex for a while, and then it kind of changed, or it may have been that they were kind of asexual, aromantic, didn't really think about it very much at all. You know, for whatever reason, that just didn't really happen. And then later in life, when they started kind of noticing people around them and started having more sexual feelings, then it kind of emerged. And then there's people that they did feel it early on, but maybe it wasn't acceptable perhaps to themselves, or wasn't acceptable to family members, or wasn't acceptable to people in the community, so they may have kind of suppressed it. And then later on, circumstances might change and they might feel more able to express it.
Yeah, and then
so it's quite varied. Yeah.
Yeah, and there's also true bisexuals who I've met, who for them it's not about the gender, it's about the person.
Okay.
Totally about the person. They don't care if the person's male or female, which is hard for me to understand, but that's what they report. Yeah. That's like true bisexuality right there. And this as well. So there's a lot of variation.
Okay. Want to remind everyone once again, welcome to the NOCD Wednesday night webinar. This is brought to you by NOCD, an app you can download on Google Play or iOS. We also have teletherapy throughout the country in 25 states currently, and continuously increase our insurance coverage as well. You can reach out to us at treatmyocd.com, or click on that little hyperlink up in the corner over there, and you can be linked to our care team. They will do a free 15-minute assessment with you to see what's going on. And if it looks like OCD may be playing a role, we'll set you up with a diagnostic assessment with one of our clinicians throughout the country. We all work in the states that we're licensed in, so give us a call to see if NOCD is available for you. Is HOCD and moral scrupulosity intertwined for some of your patients? Well, yes, absolutely, because you might see this with religious scrupulosity, because maybe in some religions not being anything but heterosexual is a sin, right? You could have a moral aspect because that morality could go also with the relationship OCD, because I've been in a relationship with someone, I've established a life with them, we've had children together, and now I'm considering leaving them for this other thing because I have now this thought in my head. So there could be a moral aspect, there could be a relationship aspect. You could see a lot of intertwining kind of going on there. Would you guys agree? So, yeah.
Yep.
All right. And then there's some people who talk about after maybe a bout of orientation OCD, it's just hard to feel attracted to anybody at all. Have you noticed that just the idea of being attracted to someone is frightening?
Not really.
No? Okay.
I've had some patients that have kind of talked about that, and I think it can make sense because they may have had kind of an aversive conditioning to the experience of sexual attraction, because they had, they felt a sexual attraction, and then they had an obsessive doubt, and they had a lot of distress around that. And so just that whole experience itself is so disconcerting that they may avoid thinking about it, or even like when they start thinking about it, they feel stress and anxiety, and stress and anxiety tends to kind of shut down your sex drive.
Okay. HOCD felt like it came out of nowhere to me. Can that happen? I'm 23 and never questioned my sexuality in my life until now. Sure, absolutely. We can see things like that happen with people. So yeah, that's not uncommon. Here we go. This is a good one. Hi. I experimented when I was 11, 12 years old, and I didn't like the experience. I'm now 16, going to be 17, and my OCD keeps using that as proof that I'm gay or bisexual. What can I do? Elise, anything?
No CD therapy. Work on it.
Yeah.
Yeah.
Of course, yeah. I mean, obviously, any answers that we give tonight are through here, and this isn't a substitute for therapy by any means. But of OCD, Jamie, you said something earlier about anxiety being, worry about the future. But I think we also have to talk about worry about the past coming back to haunt me, or something that I did in the past that now I regret having done, and what does it say about me that I did that as well too? So
Yeah.
And we can see this in all forms of OCD. I've seen it in people who are afraid that maybe once when they picked up their child, they had their hand on their child's butt too long. And now, does that mean that they really love touching their child's butt or something like that? And now that I've experimented with somebody when I was a kid, and just experimenting and didn't even know anything about really the world and relationships or anything like that. And now what does it say about me years later in my life that I would have done something like that?
Yeah.
And I always say to people, no decision we ever make is judged until after we make it, right? That you'll never know how something's going to turn out until after you do it. But OCD wants to punish you for not having known that you did this at 11 and now it's 16. You should have known at 11 that this is going to be the result. And how dare you not know that? And now we have to punish you for that, right? So,
yeah. And another thing I want to add to that question is about the idea about something being proof of something else. But there typically is not kind of one thing that's proof of this. So it's not quite as simple as that. But having OCD, often you want to try to find that thing that is proof of something else, because you want to resolve the doubt. So it's natural and understandable to try to seek that. But the reality of the world is that we don't have a lot of things where one thing is absolute proof of another thing.
And that's why it's perfect for OCD to attack people in this area, because there is no proof.
Yeah.
So it's perfect. There's so much uncertainty. It's fertile ground. But it's also treatable for anybody out there who's feeling like you can't get these thoughts out of your head and they're driving you crazy and all this. We do exposure and response prevention with this, and I've had a lot of patients do really well who have been just tortured with this stuff.
Here's a great question. Does OCD therapy look any different for the LGBTQ individual than for the heterosexual male or female?
Good question. Overall, the general themes we've been talking about are the same, because we're talking about doubts that happen, dealing with uncertainty, dealing with, not avoiding things that cause you distress to think about, and not doing compulsive behaviors to try to reassure yourself or check on yourself, research on the internet, all those things that are common in kind of orientation OCD. Everybody needs to be understood in terms of their context of their life and their relationships. And so those things are different because everybody's unique that way. And so that part of it is important for therapists to understand.
Yeah, I think in finding a therapist who feel like they accept you is really important.
Yep.
If you have ROCD about your lesbian lover and you're telling about why you doubt you should be with her, you want them to treat that OCD and not think, well, all lesbians have bad relationships anyway, so of course you're in trouble. Well, that would be a problem.
that would be a problem.
Yeah.
At least you might, and feel free, but do you find that as a lesbian therapist that there's any difference from how you might work, especially in the orientation-based OCD, than a therapist who is not LGBTQ?
Well, if the person comes out to me, I will come out to them. So that's one.
Okay.
So we connect on that level. They know where I'm coming from. I know where they're coming from. So that seems like a bonding kind of thing there. And also, I think I'm a little more comfortable with some of the exposures than someone else might be. I'm like with males who fear they might be gay, and there's no reason to think they are gay. They have all heterosexual experiences, and they're all great. I'll have them watch Game of Thrones, the kissing episodes between the men. So I come up with some pretty wacky assignments, and I think that's because I'm comfortable with the subject as well.
Sure. Sure.
Yeah, so therapists that deal with an OCD, I mean, I think probably almost all therapists, but certainly NOCD, our NOCD therapists, we are very comfortable with talking about sex. Sex comes up a lot in OCD,
Sure.
not for obvious reasons, because it's something that's important to people, and anything that's important to people can be a topic of OCD. But there's very, very open discussion and exposures that involve things that have the topic of sex.
One comment, also thinking about a place on your body automatically makes you feel a sensation there. So yeah, and that's
very good point. Yep.
Yeah.
I agree. Because your attention is brought to that area. And so that happens. Your brain, when your brain is attending to a certain part of your body or experience, then it's like bringing that into focus. Anything that's going on in that area becomes kind of magnified. That's kind of the way our brains work.
Jamie, this one's for you. Do you think it's necessary to see a psychiatrist to get over OCD? There you go.
So I'd say not necessary in many cases, because OCD can be treated by exposure and response prevention. That's one of the two first-line treatments for OCD in adults is exposure and response prevention. The other is medication. In some cases, it might be necessary. So I think that in particular in like very severe cases, particularly if a person has tried exposure and response prevention and they had some difficulties doing it, then it can be beneficial. So it's not necessary for most people, but it can be helpful for some people that nevertheless. And for some people, it might be necessary.
Yeah, I like this one. I had a dream once of me having a very sexual experience with a random guy at college that I'm not attracted to, but now I wonder if it meant something. This happened years ago, and I still think of it. Now, what do I do? I've brought up dreams to people in the past and said about how very often we're far more concerned about the thoughts we have while we're awake than we do about the thoughts we have while we're asleep. And yet, for people with OCD, the thoughts that were asleep might also have some meaning for them as well, too, because we could still read into them. So have you guys worked with people who've had a dream about maybe a same-sex or opposite-sex experience, depending on orientation, and then that sowed some seeds of doubt in them? And how did you deal with it?
Not really.
I don't think I have. I mean, it's probably just because it just hasn't happened, but I could totally understand how that could happen.
I've had one patient similar to this in the past who had a similar type of thing, and then that became the reason to do all sorts of testing. He did a ton of testing. Like he would wear a dress outside to see if he would get aroused by that. He would watch gay porn and hope to not get aroused by it, but then he would use that as proof. And I would joke with them, said I could put National Geographic on, and two donkeys could be going at it, and you could get aroused potentially from that as well too. It doesn't mean that you like donkeys. So that idea that it can be, depending especially on our age, it can be very easy to get an arousal experience, shall we say? Right? So maybe the good thing out of all that is to look at and say that OCD is just really good at reading into stuff that doesn't necessarily need to be read into whatsoever, right?
Yeah.
Okay.
And we dream a lot of things that we don't wish would happen.
Right.
And sometimes dreams probably have some meaning. Sometimes they don't. It's a mixture, right? So you will never really know, and sometimes
fear, even you could dream something you're afraid of.
All right, well, we've got about 5 minutes left, so I do want to make sure that I give both of you a chance just to kind of give some ending comments tonight, and I'll do my little wrap up of things. But it's been a wonderful discussion, and like one of the fastest hours of my life is always when we do these. But what would you like to kind of give as a message out to everybody who's with us tonight?
I'd like to let people know that this is treatable if you're having these thoughts and fears and you're, panicking about it, which a lot of people do. And I see some of the comments that we didn't get a chance to read tonight. And some people are really suffering.
You can address them. We've got a few minutes if there are things.
Okay, somebody was talking about that they had an experience where they played mother and father when they were a kid with another girl. And so now she wonders if it means she's gay. And so she's, going around and round about that. So, those kind of things are, I would just encourage you to get help. And we have a great therapy program here that's short-term and has great results. So you don't have to stay with this and worry about it for years until you get some help. So I would just encourage you to do it sooner rather than later, because it's not going to go away on its own usually. So I would just like to address the level of distress that people are under with this. They can be terrified. So you're not alone, and you don't have to stay that way.
Yeah, I would also encourage people to really get treatment sooner rather than later, just like Elise says, because we do know from research that the longer that OCD goes on untreated, the longer duration of illness, it tends to get harder to treat, which doesn't mean that, if you've had it for a long time, you can't be treated. It just means that it can be a little bit more difficult. But also, the other message I want to send too is that when you have orientation OCD, or if you have other types of OCD that are similar to this as well, that the inclination, which is I think a natural inclination, is that the person thinks a solution is that they need to try to think their way out of it, right? That they can try to figure this out with enough thought. They can get out of this. They can figure out. They can get an answer. They just need information, thought, proof to get out of it. But actually, that just digs you into kind of a deeper hole. That's the way that OCD works. Those thoughts are compulsive thoughts. And the way that we treat OCD with exposure response prevention at NOCD and other places is that we try to help you not do all the thinking that is digging you into the hole because it's compulsive. And we help you then be able to face difficult emotional experiences that happen from confronting the things that you fear. And over time, then eventually that gets better. It's called habituation. That's what exposure is about. And when you break that cycle of doing the compulsive behaviors, then what happens is that those obsessive thoughts tend to happen less. They tend to be less intense. And you get better and better at being able to not overthink it, which is kind of one of the major problems.
Yeah. Well, I want to thank you, Dr. Elise Curry and Dr. Jamie, as you say your name wrong because your name is Feusner, as far as I'm concerned. But
I do say it incorrectly. I'll respond to either one.
I'll tease you either way. This has been brought to you by NOCD. NOCD's Diversity Matters series is the third Wednesday of every month for our webinars. NOCD, downloadable app on iOS and PlayStation, and feel free to reach out to us if you would like to talk to us about our teletherapy services that we have in 25 states currently, and we continuously get more and more insurance coverage as well too. You can download the NOCD app at Google Play or iOS. It is free. I am Dr. Patrick McGrath, your continuing host of these webinars, and I really want to thank my two guests tonight. This was a great discussion, and I think will be very helpful for people to watch in the future, especially if they have HOCD questions. We got a lot of good answers out here tonight, but don't watch it too many times because then that's reassuring. So just watch it once. And that's all you know. But
thanks for having us.
Yeah. Thank you very much.
Thanks for having us. Thanks for all the great questions.
Yeah, it was great. Elise, you started us off with the button above you. That means you get to finish us off as well with the button above you. We'll stop our webinar tonight. But thank you, everyone. We'll see you again in a week.
Take care.
Bye.